Welcome, friends. Today, we're going to talk about something that affects millions of Americans, especially those of us over 60, yet often goes undiagnosed for years. It's called a hiatal hernia, and if you've been experiencing mysterious symptoms that your doctor can't quite explain, this information could be life-changing for you. Let me start by asking you something. Have you ever felt a burning sensation in your chest after eating? Maybe you've had trouble swallowing, or you've woken up at night feeling like you can't catch your breath. If you've been dismissing these symptoms as just part of getting older, or if your doctor has told you it's just stress, please keep listening. Your body might be trying to tell you something important. What exactly is a hiatal hernia? Before we dive into the symptoms, let me explain what a hiatal hernia actually is, using simple terms. Imagine your stomach as a balloon that's supposed to stay below your diaphragm, which is the large muscle that helps you breathe. In a hiatal hernia, part of your stomach pushes up through a small opening in your diaphragm and moves into your chest area where it doesn't belong. It's like having your stomach in two places at once, and this can cause all sorts of uncomfortable and sometimes frightening symptoms. The good news is that once you know what to look for, you can work with your doctor to get the right diagnosis and treatment. So let's go through these 15 symptoms together, and I'll explain each one in a way that makes sense. Symptom number 1. Heartburn that feels different. Now, we've all had heartburn at some point in our lives. But the heartburn from a hiatal hernia is different. It's not just that burning feeling after eating spicy food. This is a more intense, crushing sensation that travels up your chest and can last for hours. According to recent research from the American College of Gastroenterology, people with hiatal hernias experience heartburn that's significantly more severe than regular acid reflux. What makes this particularly frustrating is that it doesn't always follow a pattern. You might eat a bland meal and still get terrible heartburn, or you might enjoy your favorite foods one day and suffer the next. This unpredictability can make you anxious about eating, and that's completely understandable. Many people start avoiding social meals or family dinners because they're worried about when the pain will strike. Symptom number 2. Food coming back up. This is one of the most distressing symptoms. Imagine finishing your dinner, and hours later, you taste that food again in your throat or mouth. This happens because when your stomach is partially in your chest, gravity can't help keep food down where it belongs. The natural valve that usually keeps food in your stomach doesn't work properly anymore. I understand how embarrassing and uncomfortable this can be. About 7 out of 10 people with this symptom develop anxiety about eating in public. You might find yourself avoiding restaurants or dinner parties, and that's a natural response to this difficult situation. But remember, this is a medical condition, not something you're doing wrong. Symptom number 3. Trouble swallowing. Have you ever felt like food gets stuck halfway down? This frightening sensation happens because the hernia can narrow the passage where food travels to your stomach. Research shows this narrowing can reduce the space by up to 40%. That's nearly half the normal opening. When swallowing becomes difficult, it triggers very basic survival fears. After all, swallowing is something we do without thinking, thousands of times a day. When it doesn't work right, it's natural to feel panicked. Many people start eating only soft foods or liquids, which can lead to nutrition problems over time. Symptom number 4. Chest pain that mimics heart problems. This symptom sends many people rushing to the emergency room, convinced they're having a heart attack. The pain can be crushing, intense, and absolutely terrifying. The Cleveland Clinic has found that chest pain from a hiatal hernia can actually be more intense than some types of heart-related chest pain. Here's what's particularly challenging about this symptom. You might go to the emergency room, have all the heart tests come back normal, and be sent home with no answers. This can happen multiple times, leaving you feeling dismissed or even questioning your own experience. But your pain is real, and it has a real cause. The hernia pressing against surrounding organs can create this intense chest pain, especially after eating. Symptom number 5. Getting full too quickly. Remember when you could enjoy a full meal without any problems? With a hiatal hernia, you might feel completely stuffed after just a few bites. This happens because the herniated portion of your stomach sends false fullness signals to your brain. This can be incredibly frustrating, especially during special occasions or family meals. You want to enjoy food with loved ones, but your body won't cooperate. About 8 out of 10 people with this symptom report anxiety around meal planning. It's hard to know if you'll be able to finish even a small portion, which can make social eating stressful. Symptom number 6, feeling short of breath. One of the most frightening symptoms is feeling like you can't get enough air, especially after eating. Large hiatal hernias can actually compress your lung capacity by up to 25%. That's a quarter of your normal breathing space being taken up by your stomach being where it shouldn't be. Feeling short of breath triggers our most basic survival instincts. Your brain interprets this as an emergency, which can lead to panic and anxiety. Many people start avoiding activities they used to enjoy, worried that exercise or even walking might make the breathlessness worse. This is a natural response to such a scary symptom. Symptom number 7, excessive belching. We all burp occasionally, but with a hiatal hernia, the belching can be constant and uncontrollable. This happens because the hernia disrupts normal digestion, causing air to build up and forcefully escape upward. I know this might seem like a minor symptom compared to chest pain or breathing problems, but the social impact can be significant. From childhood, we're taught that burping in public is impolite. When your body does this involuntarily, especially during important moments like business meetings or quiet gatherings, it can be deeply embarrassing. Many people start avoiding social situations altogether. Symptom number 8, uncomfortable bloating. Have you noticed your abdomen swelling up like a balloon after eating? With a hiatal hernia, food doesn't move through your system properly, leading to fermentation and gas buildup. Research shows this can increase your waist size by several inches within hours of eating. This visible change in your body can be distressing. Your clothes might not fit right, and you might feel self-conscious about your appearance. About 7 out of 10 people with this symptom report avoiding form-fitting clothes or social events where they might need to eat. Remember, this is a medical issue, not a reflection of your eating habits or self-control. Symptom number 9, persistent nausea. Feeling queasy or sick to your stomach can turn every meal into a gamble. Will you feel fine, or will you spend the rest of the day fighting nausea? This happens because the hernia can compress nerves and cause acid to irritate areas it shouldn't reach. Chronic nausea affects more than just your stomach. It can make you afraid of food itself. Many people develop anxiety just thinking about eating, wondering if this meal will make them sick. This can lead to avoiding favorite foods or skipping meals entirely, which isn't good for your overall health. Symptom number 10, vomiting blood. This is a serious symptom that requires immediate medical attention. If you see bright red blood and vomit, it means the hernia has caused damage to your esophagus or stomach lining. This is not something to ignore or hope will go away on its own. I understand how frightening this can be. Seeing blood is traumatic and can leave lasting anxiety even after treatment. Many people develop a fear of eating or become hyper-aware of every stomach sensation afterward. These feelings are completely normal responses to such a scary experience. Symptom number 11, black or tarry stools. This symptom might seem less dramatic than vomiting blood, but it's equally serious. Black, tarry stools indicate internal bleeding that's been partially digested. This means you're losing blood somewhere in your digestive system, and it needs immediate medical evaluation. The psychological impact of knowing you're bleeding internally, while feeling relatively normal, can be confusing and frightening. Many people become obsessed with checking their stools, worried about what they might find. This vigilance is understandable when dealing with such a serious symptom. Symptom number 12, chronic cough that won't go away. Have you been dealing with a persistent cough that no cough medicine seems to help? This happens when stomach acid travels up and irritates your airways. It's not a lung problem. It's acid from your stomach burning your throat and voice box from below. This can be particularly frustrating because people might think you're contagious when you're not. In our current world, any persistent cough can make others uncomfortable, leading to social isolation. About 7 out of 10 people with this symptom report feeling like social outcasts, even though their cough isn't infectious. Symptom number 13. Hoarse voice or sore throat. If your voice has become raspy or hoarse, especially in the morning, it might not be from talking too much. Stomach acid can damage your vocal cords while you sleep, causing chronic irritation and voice changes. Your voice is part of your identity. When it changes, it can affect your confidence and how you communicate with others. Teachers, singers, and anyone who relies on their voice for work can find this particularly distressing. Even in everyday conversation, you might feel self-conscious about how you sound. Symptom number 14. Persistent bad breath. Despite excellent dental hygiene, you might notice persistent bad breath that mouthwash can't fix. This happens because food and acid lingering in your esophagus create an environment where bacteria thrive, producing unpleasant odors. This symptom can be particularly challenging because you might not even be aware of it, but others are. It can affect relationships and social confidence. Many people become anxious in close conversations, worried about offending others. Remember, this is a medical issue that can be treated, not a reflection of your hygiene. Symptom number 15. Frequent hiccups. While hiccups might seem like the least serious symptom, persistent or frequent hiccups can be maddening. They occur when the hernia irritates your diaphragm, the muscle involved in both breathing and hiccuping. Chronic hiccups can disrupt sleep, make eating difficult, and be embarrassing in quiet settings. They're another way your body is signaling that something isn't right with your digestive system. Now that we've covered the symptoms, let's talk about how to get properly diagnosed. If you recognize several of these symptoms, don't let anyone dismiss your concerns as just stress or normal aging. You deserve answers and appropriate treatment. The most important test is called a barium swallow study. You'll drink a chalky liquid while X-rays track its movement through your system. This clearly shows if your stomach has pushed through your diaphragm. The test is painless and provides clear visual evidence of a hernia. Another crucial test is an upper endoscopy, where a tiny camera examines your esophagus and stomach directly. This can reveal inflammation, damage, or bleeding that confirms the hernia and its effects. Your doctor might also recommend esophageal manometry, which measures the pressure in your swallowing muscles, or pH monitoring, which tracks acid levels in your esophagus for 24 hours. Don't accept basic blood tests or a simple physical exam as sufficient. Hiatal hernias require specific imaging tests for proper diagnosis. If your primary doctor won't order these tests, ask for a referral to a gastroenterologist, a specialist in digestive problems. Living with these symptoms can be exhausting, both physically and emotionally. You might feel like your body has betrayed you, or that no one understands what you're going through. But please know that you're not alone. Millions of Americans, especially those of us over 60, deal with hiatal hernias every day. The good news is that once properly diagnosed, there are many treatment options available. These range from lifestyle changes and medications to surgical procedures for severe cases. The key is getting that proper diagnosis first. Remember, advocating for your health isn't being difficult or demanding. It's taking care of yourself. You know your body better than anyone, and if something doesn't feel right, it probably isn't. Trust your instincts and keep seeking answers until you get them. I hope this information helps you understand what might be happening in your body and gives you the confidence to seek proper medical care. These symptoms aren't just part of getting older or all in your head. They're real, they have a cause, and they can be treated. Take this information to your doctor. Be specific about your symptoms. Ask for the tests I've mentioned. You deserve to enjoy meals with your family, sleep peacefully through the night, and live without constant discomfort or fear. Thank you for taking the time to learn about this important health issue. Your health matters, your comfort matters, and you matter. Don't give up on finding answers and getting the treatment you need. With proper diagnosis and care, you can feel better and return to enjoying the activities and foods you love. Remember, you're not alone in this journey, and there is hope for improvement. Take care of yourself, and don't hesitate to seek the medical attention you deserve.